Hello everyone, my name is Jenny Ramirez. I chose the topic of preventative measures for intraventricular hemorrhages or IVH in preterm infants. I currently work in a neonatal intensive care unit, and IVH is almost inevitable for preterm infants. Because the germinal matrix vascularity in their ventricles is so fragile, any disruption in the blood flow within the ventricles is detrimental to their long-term quality of life. Once a preterm infant has developed a hemorrhage, the bleed could either worsen or resolve independently. The focus on my review was to search for measures such as nursing interventions and methods to prevent IVH in preterm infants. So this led to my research question. For preterm infants in a neonatal intensive care unit, what nursing interventions or methods can decrease the risk of intraventricular hemorrhages? When conducting my research, I primarily used the database CINAHL. This database is my go-to in any nursing research because it is the most comprehensive research worldwide that compiles all nursing literature into one. The search terms used were prevention, interventions by nurses, disturbance in cerebral blood flow, intraventricular hemorrhages, preterm infants, risk associated, nursing care, NICU, periventricular leukomalacia, cerebral palsy, and post-hemorrhagic hydrocephalus. Several important exclusion criteria applied were infants born preterm, grade 1 IVH, and data collected before 2013. It is necessary to use the most up-to-date articles within the past 5 years since experiments in nursing care is continuously growing and advancing. Grade 1 IVH was excluded because this degree of hemorrhages typically resolves on its own and it does not affect the quality of life of a preterm infant. After narrowing my records by using an inclusion and exclusion criteria, along with the quality appraisal tool, I came across several articles that contributed to my review. While there has been many experiments and studies completed on the prevention of IVH, my focus was to search for interventions that could be implemented at the bedside by the nurse. So the articles used for the literature review are displayed centrally within the poster. This evidence table is alphabetically lists the records by the contributing authors. Then, the objectives, designs, interventions, results, conclusions, and limitations follow. Many of the articles were focused on implementing care that decreased the abrupt change in cerebral blood flow for the preterm infant. Many are not aware, but simply changing a diaper of a premature infant incorrectly can actually lead to IVH. Rather than lifting the infant by their feet or ankles like most of us change a diaper, lifting them by their hips is the alternative. Another preventative measure is to always maintain a midline and neutral position for the infant, with the head of the bed at a 20-degree angle or lower. In addition to their position in the bed, keeping the infant midline with the head of bed flat for the first 72 hours of life is also critical in preventing IVH. Decreasing how frequently the provider goes in and sections the patient's oral cavity and endotracheal tube can also aid in reduction. These interventions maintain a balance and avoid disruption in the cerebral blood flow. One recommendation to consider is protective positioning devices for the infant that encounter rough or unstable transfer conditions to prevent shifts in their body and their head. Experiments are ongoing for the prevention of IVH and how to control them from worsening when it occurs. The implementation of the preventative measures is necessary, but education on the etiology and long-term effects of IVH is just as important. Thank you.